Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
With the addition of tetracycline into the armamentarium of physicians a number of years ago began to prescribe this drug for certain childhood disorders such as otitis media, cystic fibrosis, urinary tract infections, and many other infections that needed a broad-spectrum antibiotic. Little did they realize that they were doing irreparable damage to the permanent dentition of these children. With us today, we have a young lady who did have some tetracycline medication during her earlier years. And as we look into her mouth here, we can see that she has some gray, yellow, and brown stains on the anterior teeth produced by the tetracycline. What has happened is that the tetracycline has incorporated itself into the enamel during the formation of the tooth. Dentists are starting to see these patients today with these stained teeth and are wondering what to do. One suggestion might be to put complete coverage on these teeth. But again, these pulps are very large. We have to remember that such restorations might produce the demise of these pulps. We're looking for an efficient, easy way to see if we can lighten these teeth, and this is what we're going to demonstrate today, is a bleaching technique using an oxidizing agent such as superoxole. When the patient comes to the office and she asks, "Can you help me out at all, doctor? Are my teeth such that you can bleach them for me?" There are several points we like to go through. First, we do an oral examination. We like to look at the teeth, make sure that there are no restorations on these teeth, that there are no cracks or crazes on these teeth, that the superoxole might go through and produce irreparable damage to the pulp. The next thing we'd like to do is to look at a set of radiographs of these teeth. And the purpose for the radiograph is to make sure that, again, there are no obvious defects in the teeth or that there's no periapical pathology. And thirdly, during the screening examination, we'd like to check the vitality of these teeth. We'd like to make sure that her teeth are vital and healthy at the start of the procedure. After we've gone through a bleaching sequence, we'll check later to make sure that we didn't produce any irreparable damage to these teeth. Now, Carolyn, we're going to test your teeth with the vitalometer. If you feel something that's discomfort, let us know. Just make a little noise. Okay, number 7's vital. I'd like to demonstrate the bleaching technique for you. First, let's look at some of the items that we're going to need to go through the bleaching procedure. First of all, we need the conventional rubber dam setup, dam, frame, clamps, so forth. We're going to need a spoon excavator and some lubricant. We also need, of course, the superoxole, or 30% hydrogen peroxide, as the bleaching agent. It's nice to have some alcohol to clean some of the lubricant off of the teeth, a mirror so we can show the patient the effects of what we've tried to do, some mouth retractors for intraoral photography. It's good to have a good camera to pick up the results of our bleaching attempts, both before and after the procedure. And also, the most important part of the whole procedure is the bleaching tool itself. This happens to be a small rheostat which has been calibrated to allow us to get a certain temperature on the tip of just a normal hobby shop type of wood burning iron. We'd like to be able to calibrate this so that we can have temperatures here someplace between the temperatures of 100 and 160 degrees. Now I'm going to start out by going through the first step on this procedure, which is giving this young lady a pumice prophy on the 6 anterior teeth. It's the 6 anterior teeth that usually we bleach on people that have staining like this. This is what they show to the public, and this is what is best lightened, or easiest lightened. Now we'll go ahead with the prophylaxis. We like to clean away some of the food stains on the teeth. We like to clean away some of the materia alba. This will allow our agents to get at the enamel a little bit better. Now Carolyn here keeps her teeth nice and clean all the time, so she doesn't have too much here for us to clean away. Okay, just a very simple prophylaxis, and that's all that's needed. Now let's wash away all the toothpaste here. Now the next thing I'm going to do is to take some intraoral photographs at the beginning of this sequence. Now we'll put some lip retractors on Carolyn. That's fine, there's one. There's another one. Now bring up 2 hands and just, oops, we got your bottom teeth there. Okay, now bring up your hands and just hold on to there. Close down a little bit. Now we're able by photography to register both before and after pictures of our work. Now if you don't have a real good camera that can make registrations like this, then my suggestion is to use something like a good shade guide. But because of the gray color and the variations of color on the teeth, sometimes it's very difficult to use a shade guide. Now one thing I caution you is that this may be a little bit uncomfortable for the patient, especially when we ligate the teeth. But by all means, do not anesthetize this patient, because we're going to be applying heat to the pulp. And if the patient is anesthetized, we could kill the pulp. Now let's go ahead with the ligation of the teeth. We'll get our rubber dam prepared. Usually what I recommend is placing 8 holes in the rubber dam, the smallest holes possible. Since we're going to be doing 6 anterior teeth, we'll usually make 8 holes in the rubber dam. 2 holes will be for the bicuspids. 6, 7, 8. And these holes are all widely spaced such that we have an area to protect the gingiva. Now, next thing I'm going to do is to apply a good bit of lubricant to the gums. The purpose of the lubricant is to keep any damage from occurring to the gums should the superoxide seep up under the rubber dam ligation. And what I try and do is work the lubricant into the interproximal areas on the teeth. This is the area that's most likely to become burned with the superoxide. Okay, let's give you a slide ejector here and have you stay open. That's just fine. Next, we're going to apply the rubber dam. First, we'll put the rubber dam over the teeth and then go through the ligation procedure. You find when you have both the teeth and the rubber dam lubricated like this, it gets quite slippery. Okay, that completes the application of the rubber dam. We have the rubber dam surrounding the 6 anterior teeth, and we have each bicuspid clamped. Now the next thing we're going to do is go ahead and do our ligation. What we use is a heavy dental floss. We'll place it around each tooth. Let's start with the central incisor here. We'll try and work that rubber dam subgingivally if we can. Now if you notice, Carolyn is a little bit uncomfortable when we do this. The gingiva, of course, is quite tender. But again, I remind you, do not anesthetize this patient. A little bit of discomfort here is well tolerated because it's better again than producing permanent damage to the tooth with heat treating on an anesthetized patient. Okay. Here we got one ligation on. Now let's go on to the next central incisor. The ligation of the 6 anterior teeth is now complete. Next, we'll wash over the 6 anterior teeth with some cotton moistened in alcohol. The purpose of this is to remove any of the lubricant that remained on the tooth. Again, to allow us to better get at the enamel with the oxidizing agent. Let's just dry up a little bit here. Now the next thing I'm going to do is break up a cotton roll. Take small pieces of cotton that I can form to the size of the labial surface of each tooth. And it's these little pieces of cotton that will ultimately saturate in superoxole. Now, before I apply any superoxole to the tooth, let me have you listen to the instructions I'm going to give Carolyn. This is important. Carolyn, I'm going to apply some agent to your teeth that might cause a burning sensation if it seeps up under the rubber dam and up against the gum. If the gum starts to burn at all, if it's very uncomfortable, you make some noise and try to point to that. And if the gum is burned, what I'll do is get out our suction and our water here and wash everything down real quickly. And some of that burning sensation should stop. When I'm putting the agent on your tooth, which I'll start doing now on the cotton, I'm going to be using a hot instrument on your tooth. And I'm going to be heating up each tooth. And if you feel the heat, you make some noise again, and I'll move to the next tooth. Now if you try and be real brave and put up with all the discomfort, we could actually heat up that tooth too hot and cause it to die. Understand that? Mm-hmm. Okay. Now I've got the agent on the cotton on each tooth. Now I will take the small iron and apply it to the labial surface of each tooth. What I like to do is move from tooth to tooth before we actually heat up the pulp too warm. Okay, here we are. We've made it around one side again. Again, if you feel anything, you just make a little bit of noise. Then we know we're getting too warm. Oh, she felt that one. By heating the superoxole thusly, we'll increase the effectiveness of its abilities to bleach about 20-fold. Oh, she felt that one a little bit. Now we usually bring the patient back for 3 appointments. And during those 3 appointments, we work for about 20 minutes in this manner, going from tooth to tooth, applying heat. Now, usually about every 5 minutes, what we'll do is stop, take the cotton that has been previously saturated with superoxide off of the tooth, dry it, a small piece of cotton, and then add some fresh superoxide to that piece of cotton and put it back on the tooth again. And we'll do this to the next piece of cotton here, and so forth. Usually about every 5 minutes, freshen up the superoxide, and then continue on the bleaching procedure, moving from tooth to tooth. We've been working on Carolyn here for 20 minutes. We limit our appointments to 20 minutes each time. Now, what I'm going to do is get rid of all the cotton, flush off the teeth, and remove the rubber dam, and then we'll get a chance to see what kind of result we have today. When you are doing vital bleaching on patients, during the consultation appointment, never promise a patient that you are going to lighten their teeth. Colors such as gray are very, very difficult to bleach. Other colors such as yellow and brown may disappear with a lot more ease. But again, never promise a patient what you're going to do, because sometimes it's just about impossible. Okay, we'll get rid of all the ligature here. There we go. And we'll get that rubber dam right off. And Carolyn knows that's a welcome relief. She's been a real good patient this afternoon. Okay, off comes the rubber dam. Now, let's go ahead and wash off the gingiva once more. Now we'll get everything put away here and take a good look at our result. Okay, we can see some change between the upper and lower teeth. And I see a little burn over here on the gingiva. You want to turn your head over this way a little bit, Carolyn? See this little white spot right on the papilla. Okay, now let's finish our procedure by taking some pictures again. And we'll just slide those right under the gums again. And will you hold on there, please, for me, Carolyn? That's fine. And close up just a little bit. That's fine. One and two. Now we get a real good look at this young lady's teeth. Again, we can see there is some change between the upper and lower teeth. The upper ones look a little bit lighter. We'll bring Carolyn back in another 2 weeks and do the same procedure again. Usually we'll do this procedure for about 3 times, perhaps 4, and usually that's about the maximum amount of lightening that we can expect. When Carolyn comes back, I would expect the teeth to be just a little bit darker than we saw today, but this is the usual procedure. Now, going to our pictures that we took, let me show you 2 pictures of a patient before the treatment actually began, and then again after a series of 3 treatments. You can see there's significant lightening of these teeth, and this, even though aesthetically may not be absolutely pleasing to the dental practitioner, believe me, was very pleasing to the patient, to her parents, and to her friends. I'd like to take and review the procedure very, very quickly of the bleaching technique. The first thing we'd like to do is to screen the patient. Take an oral exam, take a good look at those teeth, take an x-ray exam, view the periapical area very carefully, and do the electric pulp test to ensure vitality. Next, polish the teeth. When you're polishing the teeth, the purpose is to remove any debris the patient may have on those teeth when they come to the office. Next, do a correct application of the rubber dam and ligate the teeth properly. The purpose of this, again, is to protect the gingiva from any accidental burn from the superoxide or hydrogen peroxide solutions you're using. And finally, the bleaching procedure. Remember, during the bleaching procedure, the patient is at all times aware of what you're doing and can tell you if you're heating up the teeth too much. This is important. But don't let me overemphasize one point. Please, please do not anesthetize the teeth. We don't want any pulp deaths as a result of trying to make the patient's appearance aesthetically more pleasing.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.